Welcome to the Reinhartz Rundown, our COPD series. Today, we'll review some of the characteristics of COPD. Here are the top 5. Number 1, preventable. Continuing to support our patients with the 5 A's of smoking cessation is really so important for prevention of COPD disease. Number 2, it is progressive. So COPD generally does continue to worsen over time, and remember that smoking cessation is the only disease management strategy really proven to slow progression of the disease. Number 3, unlike asthma, COPD is not fully reversible. This means that even though there is a chronic inflammatory response occurring, the airway limitations typically worsen and cannot be reversed. Number 4, it is characterized by airflow limitation. So this really happens as a result of a different cascade of steps. We have, number 1, inhalation of noxious gas or smoke, which is irritating. The lungs aren't happy, and they respond by becoming inflamed. With continued exposure, the inflammatory response becomes chronic, and we see endothelial changes in the airways. Mucociliary function is lost, we have hypersecretion of mucus, and over the long haul, we have narrowing and fibrosis of the actual airways. Along with this, we see alveolar function that is lost. This results in that trapping of air effect. We know this, of course, as something like emphysema, but really this is only, one of the many different structural changes we see with COPD. Number 5, it is treatable. While yes, smoking cessation is the best way to prevent progression, drug therapies, vaccinations, pulmonary rehabilitation, all can go a long way with improving symptoms, preventing exacerbations, and improving quality of life for all COPD patients. All right, those are the 5 characteristics of chronic obstructive pulmonary disease. Hit subscribe for our next videos, information coming on symptoms, genetic considerations, practical COPD assessment tools, counseling details, and more. That's the Reinhartz Rundown.